Do you suffer from leg pain, swelling, or bulging veins? Well, you may think these are normal signs of aging, but it could be vein disease. Local vein specialist Dr. Fernandez is here to tell us why it's never been easier or more important to treat your veins. So welcome, Dr. Fernandez. How are you?
Good, Julie, and thank you so much for having me. I appreciate it.
So thank you for coming in and talking about this, because I think a lot of people think that varicose veins, it's a cosmetic issue, but you're here to tell me that it's not?
It is not.
Okay.
And that's perhaps the biggest problem with venous disease is the stigma that it can be just a cosmetic issue. People
Right.
look at varicose veins and they felt, this is not my thing. I don't really care about how my legs look. But veins really are the first flag, let's say, the first warning shot from your body that there is a problem. Veins function through valves that help blood fluctuate up towards the heart. And those valves can fail. They can fail because of obesity, age, family history, very important. One parent with this condition gives you a 40% risk of developing.
Wow.
Both parents, 90% risk.
That's huge.
And when that blood pools, that pressure leads to the formation of the varicose veins.
Oh my gosh. Okay, so what is venous insufficiency, vein disease, if you will? Let's talk about that.
So venous insufficiency is that malfunction of the valves. So the valves are literally one way. So if I can just replicate, they open, they close, and they prevent gravity from pulling that blood back.
Okay.
And those valves, just mechanically simply, when they break down because of all those risk factors we talked about, then the blood just can't allow to pull back, and it's not able to flow up naturally. And that volume creates that pressure. And it's another name that we use for it is venous hypertension.
Okay.
And people are familiar with the word hypertension, high blood pressure.
Yes.
That's usually in the arterial system, but in the venous system leads to a series of complications.
Okay, so then obviously it's important to treat vein disease. How do we do that?
Great question. So venous disease used to be, unfortunately, difficult to treat in the past because it needed an operative room, general anesthesia, high time for recovery, high risk of formation of blood clots. Now, technology, just like everything else in life, has made our life a lot easier and has really changed, has come into minimally invasive techniques. We use radiofrequency and laser catheters, which are a form of heat. We use glues now to close the vein. Yeah, just literally crazy glue the vein shut. And, we use little mechanical methods. We use little foam chemicals that you can just literally just foam and inject into the vein.
And how often is the downtime, or how much downtime does one need after you do this?
And that's what has really changed wonderfully. So now these are outpatient in-office procedure. They require no anesthesia, sometimes just a little bit of lidocaine. The patient will be in the office usually around 30 minutes. And That's it. And then they go back to their daily activities. Depending on the procedure, they might have some limitations, no running, no jumping. When you come into the glue, there are no limitations. Patients can go running that following day. So the treatments have really changed. And what we're really preventing here is the complications that we can talk about.
Yeah, sure. Well, let's see the demo. You have your equipment and everything here. So what are we going to do?
So this is how we diagnose where there is a failure. We can look at the patient clinically. We can see the varicosities. We can see the swelling that is present. We can see the skin changes. A patient might show up with an ulcer, because those are all the complications of venous disease. And we can sort of say, we know that there is a problem. Where is the problem coming from? Where in the vasculature is this happening? And this is the other revolution. The ultrasound machine has allowed us to...
It's a typical ultrasound, nothing fancy here.
Nothing fancy, and you can literally put it in this case, to the patient's leg. And
then you'll see.
And you can actually see right into the patient's vasculature, identified the vessel. And then through different maneuvers right in the office, identify where that valve might be have failed.
And then you can tell us which procedure would be better, if it's the glue or the laser or the foam. And then you can go in there and do that. And then do I take it that you have to wear support stockings after?
So I have those here because they're not necessarily necessary after each of the procedures. Some procedures don't require it.
Okay.
I think they're a good preventive technique to use in the long term. The issue with compression stocking is that they don't reverse the problem. They don't cure the problem. They're difficult to don off, on and off for the patient. So the compliance is an issue. But for those patients that can do it, I think it's a nice long-term preventive with exercise and weight management.
Cool. I love it. Dr. Fernandez, where do we find you and get more information on what we may need for
Absolutely.
these veins?
So I'm part of the Center for Vein Restoration and Center for Vascular Medicine. We are the largest nation-wide providers of vascular care and the most complete. So I'm myself in the North Bethesda office and in the Silver Spring office. But we have offices around in the area, DMV area, from Alexandria, Fredericksburg, Fairfax, Herndon, Greenbelt.
Yeah,
so we cover all the
DMV.
DMV very well.
All right.
Yeah, make it inconvenient.
Thank you so much. I love it. Thank
Julie,
you.
thank you so much. Thanks for having me.
All right. Well, stay with us because there is more of Let's Talk Live coming up right after the break.